Welcome to Wildcat Science with Mrs. Haugo. This is Human Biology, Chapter 22 on the urinary system, Part 3. And we're going to start out today labeling the nephron. So please find a worksheet that looks like this. If you don't have one, then make this in your notebook. Alright, so your nephrons actually look a little bit more like that. The glomerulus. So that is this ball of blood vessels, of capillaries that comes into the nephron. So it's this, label that. Bowman's capsule is the beginning of the nephron, and it is the capsule that surrounds the glomerulus. And then please label the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, the collecting tube, and then I'm going to have you draw like a little pyramid and then label the cortex and the medulla. Okay, great. So here's another look at some things. So we have like a renal pyramid here, part of the kidney, and you have your collecting duct, and then you have a cortical nephron that just is in the cortex, and then you have a juxtamedullary nephron that goes down into the medulla. And you can see the Bowman's capsule, all those capillaries, and then the glomerulus and all those capillaries, and then surrounding it the Bowman's capsule. The proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, and then the collecting tube. So then in this kidney there's about 1 million of those little nephrons, and we can see that they are found in these pyramids, and then again the cortex and the medulla, and then all those little collecting tubes come together into the renal pelvis, and then those all dump into the ureter. Okay, filtration of the blood into urine is 3 phases. You don't have to write these down. We'll get into them just now. There's glomerular filtration, tubular reabsorption, and tubular secretion. And we can see it's happening in the kidney. And then here is a really blown up view of our nephron, again, with the glomerulus, the Bowman's capsule, the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, and the collecting duct. You can see it's all really surrounded by capillaries. Okay, glomerular filtration. Let's jump in. The arterioles, so small arteries in the kidneys, deliver blood to the bundle of capillaries called the glomerulus. The glomerulus is surrounded by a capsule called Bowman's capsule. And that's part of the nephron. And the blood flows through the glomerulus, and most of the blood plasma is pushed out of the capillaries and then into the Bowman's capsule. So most of your blood actually goes into the nephron, and now that liquid we call filtrate. So we don't call it blood or blood plasma anymore, we call it filtrate. So it's kind of like if you're going to clean out the refrigerator, taking everything out first. Instead of just taking out the moldy food, we take everything out. Okay, so here's a picture. We have some arterioles, and we have our glomerulus, and then the venules, and then this would be your Bowman's capsule. So only the blood cells and a very small amount of plasma is left in these capillaries coming out. And everything else is filtrate in the kidneys. So all of those ions and dissolved substances and nitrogenous waste and everything. Your kidneys make 180 liters of filtrate every day, and you only make 1.5 liters of urine approximately every day. So that is, like 1%, less than 1%. So 99% of it has to get brought back. And that happens during tubular reabsorption. So the liquid filtrate in the capsule flows through a series of tubules. So the cells surrounding those tubules, like the proximal convoluted tubule, the leaf of Henle, and the distal convoluted tubule, they reabsorb water. So they bring water from the filtrate from the nephron, from the urine, into the body, back into the blood, and then any substances it needs as well. The water leaves the filtrate in the descending limb of the loop of Henle because the medulla is salty, and we know that water moves from high concentration of water to low concentration of water. So if it's salty, it's more salt, less water, so the water wants to leave the nephron and go back into the body. When the hormone ADH is secreted, more water will be reabsorbed into the blood, making concentrated urine. If you remember, ADH is antidiuretic hormone, so it is not a diuretic, it's an antidiuretic. So it says take more water out of the urine, bring it back into the body, bring it back to the blood, and then you get concentrated urine. Our third and final phase is tubular secretion. So waste products that are present in the blood are secreted into the filtrate. So your body says, oh, we're going to get rid of all these extra things we don't want, and it puts it into the urine. For example, some excess hydrogen ions go into the urine. So taking a look at this picture, we have blood coming in to the glomerulus, and there is glomerular filtration, where basically everything goes into the nephron. And then there was tubular reabsorption, where anything in the filtrate we want goes back into the body. And then there is tubular secretion, where any of the bad stuff goes from the blood into the urine, into the filtrate to become urine and to leave the body. All right, just a quick review of these steps. In filtration, the fluid, which happens in the glomerulus and the Bowman's capsule, the fluid is squeezed out of the glomerular capillary bed. And then in reabsorption, any of the good stuff goes from the filtrate back into your body, like most of your nutrients, most of the water, all of your essential ions go back to the blood. And then in tubular secretion, anything we don't want gets pumped from the body into the urine. So most moves additional undesirable molecules into the tubule from your body, from the blood. After all three of those steps, what do we have? So in the end, the blood exiting the capillaries, exiting the kidney, has reabsorbed everything the body needs to function. All of the nutrients, most of the water and the ions, and the filtrate in the tubule is now urine, and that contains only excess water and your waste products, and then any excess ions that you have in your body. Urinary system disorders. What could possibly go wrong with the urinary system? So we're going to look in our books about Adam and read about what's going on with Adam's prostate. Just a warning, I'm going to tell you what it is: benign prostatic hypertrophy or an enlarged prostate. This is found in men over 40, and it is actually quite common in men over 80. Only men have a prostate, so women don't have to worry about this. Symptoms: frequent or urgent need to urinate, the increased frequency of urination at night, which is called nocturia, difficulty starting urination, the inability to completely empty the bladder, and it's often just bothersome, but if it's benign prostatic, it means it's not prostate cancer. So it's just large and it's kind of blocking the flow of urine, and it's usually just bothersome, but it can get to the point where if it blocks the flow of urine out of the bladder, that causes kidney problems, and that is a huge issue. Well, what can we do about this? Treatments. So there are medications available to make urination easier and to shrink the prostate. You could have surgery, and that would reduce the size of the prostate. You could kind of part of it off. But that all sounds unpleasant. How could we prevent it? The main thing is to maintain a healthy weight and to exercise. So we will check in with Adam again. All right, what else could go wrong? There are urinary tract infections and abbreviated UTI, and these are bacterial infections in the urethra, bladder, or the kidney. So the kidney, bladder, and urethra shouldn't have bacteria in them. And if they do, that bacteria, it's nice and moist and warm and can grow, and that causes problems. Often, bacteria is from the large intestine. E. coli is a common bacteria in your large intestine, and it will kind of invade the urethra from the anus. Sex can introduce bacteria into the urinary tract, and both men and women get UTIs. Women are they get them much more often because they have a short urethra and it's closer to the anus. How do you know if you have a UTI? If it burns when you're urinating, you should tell somebody, you should go to a doctor. That's usually a sign that something is wrong. If there's a frequent or intense urge to urinate, even though you don't have a lot of urine come out. If you have pain or pressure in your back or lower abdomen, it's getting serious, like go to the doctor. And if you ever have blood in your urine, there's not supposed to be blood in your urine, go to the doctor. So cloudy, dark, bloody, or strange smelling urine means there's an issue, go to the doctor. These mean that it has gotten past the urethra, maybe gone into the bladder, and it can go up into the kidneys. And once it goes into the kidneys, it's a big issue. So don't wait that long. Okay, what can we do to treat it? They're actually fairly easy to treat. It's a bacterial infection, so you will get a course of antibiotics. And like I said, it's very common. 50% of women will get a UTI sometime in their lifetime, or maybe more than one. But it sounds kind of unpleasant. How can we prevent this? So females should wipe from front to back. You don't want to bring the E. coli from the anus towards the urethra, so always wipe front to back. So good to know if you're a female or if you are going to take care of a child, going to be a dad, wipe front to back. Do not let yourself get dehydrated. Drink plenty of water, and that will help flush out the system. Do not douche. Just a great standard piece of advice. Douching messes everything up. Do not do it. This is for females. Also, urinating after sex helps kind of flush things out. And cotton underwear is a great choice. So wearing cotton underwear and avoiding tight jeans. Yep, those are good things to do. Okay, we're going to talk about nephrolithiasis or kidney stones. So what are kidney stones? They are little crystals of salts and minerals in your urine. And they are usually little crystals of calcium that kind of crystallize out of solution, and they can cause problems because they are not liquid. They range from the size of a sugar crystal or smaller to a ping pong ball. So if you imagine a ping pong ball coming out of your urethra, that would be quite painful. So what causes these? Well, some people are more genetically predisposed to it. Dehydration, drink water. Having a high protein diet, having a lot of salt in your diet, and being overweight makes it more likely you will get a kidney stone. Well, how do you know if you have a kidney stone? They will cause severe pain in the side and the back below the ribs. So what can we do about this? You can take pain meds and water and just kind of let them pass. There are medications that can help with that and kind of break them up. You can get shock waves that actually break them up into smaller pieces. Or if it's really bad, uteroscopy, where they're going to have to go into your ureters and get them out. And our urinary system is finished. Good job, everybody.